So today we'll be looking at theories, models, and frameworks in implementation science, and we're going to adopt the following outline. So we'll look at an introduction to theories, models, and frameworks. We'll look at the reasons why they matter in implementation science, categories of theories, models, and frameworks, the types, applications, and we'll conclude. So the objective of this study is that by the end of this presentation, we should be able to define and know the differences between theories, models, and frameworks in the context of implementation science. And we should also be able to identify commonly used theories, models, and frameworks and apply them in real-world implementation scenarios. So we're going to start with an introduction to theories, models, and frameworks. So I just want us to imagine a scenario where we are taking a road trip to a place that we do not know, and then you realize that all you need for that road trip is not only the car and your fuel, but you also need to be able to understand reasons why you will take that particular road. You should also be able to understand how you are going to take the particular road. How, okay, I'm going to leave from this city to another city. It's like your itinerary for your journey. And in terms of the framework, it's going to list everything that can be a barrier or a facilitator to your journey. So beginning with this, with having this kind of scenario at the back of our mind, we're going to be defining theories as principles or statements that are developed to describe and explain a phenomenon. And implementation science theories attempt to explain and predict why an implementation is successful or why the implementation of a particular EBI failed. Then looking at models, we want to look at the model as a simplified version of a theory, just like a road trip scenario where you know that, okay, I'm going to leave from city, maybe Yaoundé to Douala, then to Boya. The models provides a step-by-step process of how you can actually translate your research into practice. And then for the framework, a framework is like an embodiment of all the theories and the models. And then it provides a strategic plan that is going to help you to be able to develop your intervention, manage your intervention, and even evaluate your intervention. So when it comes to theories, models, and frameworks, there are over 170 of them, but we are not going to be able to look into all of these 170. But you know that of these, 81% of them are used to inform the design of an intervention. 67% of these are used in the implementation process itself. 55 are used for evaluation of the intervention, pardon. 32% for dissemination, and 23% of these are used for sustainability and scalability of the interventions. So we should know that theories, models, and frameworks are the cornerstone of implementation science. And without a theory or without a model, without a framework, it's difficult to actually implement your intervention in a way that is going to suit your desired context. And as they say, interventions that have been implemented, backed by theories, models, and framework, have higher chances of succeeding compared to those that have not been backed by theories, models, and frameworks. So when it comes to theories, models, and frameworks, there are actually 6 core concepts whereby the implementation involves an innovation. The first thing is for you to be able to come up with what you need to implement. What is the innovative idea? What is the product you're bringing to the market? It may be a product, it may be a service, it may be a policy. So all of these can be considered as the evidence-based intervention, as we looked at during our previous lesson. So there are 6 core concepts. You have an innovation, you have a multi-level context. A multi-level context in the sense that it involves not only where you're going to be implementing, that's the inner context, but it also involves the outer context or the setting. And we should take note here that the setting or context in implementation science is very important, because we establish the fact that it's not a one-size-fits-all. What works for A not necessarily going to work for B, and what has been implemented and successful in A doesn't assure that it's going to be successful in B. So you have to take note of the setting, and you also take note of the fact that it's a multi-stage process, usually complex, usually very complex, and also influenced by a lot of factors and strategies. And all of this can also be evaluated. So understanding context in implementation science is very important, because all of these interventions are going to be implemented within a particular context. We also already know that what works for A does not necessarily work for B. So we're going to be looking at context in terms of the inner setting. The inner setting, that's where the intervention is going to be implemented. And here you should take account in the structure, the cultural values, and also the beliefs of the people of that place, because they are going to influence how the interventions can be implemented or adopted. And then we have the outer setting. This is more on a political level. That's the funding, the social aspects, political context. And we should take note that within the context of implementing an intervention, you need to be the process for which the intervention is going to be implemented. And you should integrate implementation strategies into it in a way that is going to suit our context. So why do they matter in implementation science? So they form the cornerstone of implementation science. That's because they're backed by theories. You can easily know that, okay, because this theory has been proven to be effective, if I use it, the likelihood of my intervention to be effective is to some extent positive. We also provide a structured approach to understanding, guiding, and evaluating the complex process of translating research into practical applications. Implementing an intervention is usually very complex, but the use of theories and models have made it very possible for us to be able to break down or demystify this complex nature of it in a way that it becomes easy, knowing that, okay, I'm going to follow these particular steps, just like I'm going to leave from Yaoundé to Douala to Boya. So following these particular steps, I'm going to be able to reach my destination. That is a successful implementation of an intervention. They also help researchers and practitioners understand the multifaceted nature of the implementation process. Thus, it enables them to be able to adopt the implementation process in a way that is going to fit into the context. And also using theoretic models and frameworks also increases the ability of that intervention to be replicated in a similar context or setting. So now we're going to be looking at the classifications of these theories, models, and frameworks. So this concept was actually introduced by Nielsen, and it has three main aims. That's describing and guiding the process of translating research into practice, and also the aim of understanding and explaining what influences our implementation outcomes, and also the use of theories and models in evaluating our implementation. We have process models. An example of these process models, you have knowledge to action models. And for the purpose of understanding and explaining our implementation outcomes, we have determinant frameworks, we have classic theories and implementation theories. Process models, determinant frameworks, classic theories, implementation theories, and evaluation frameworks. So because of time, we're going to look at each example. We're going to look at an example from each of these models, frameworks, and theories. So this is a recommended paper for us to actually look at, where we see clarity out of chaos, how we can actually use theories in implementation research. And again, this is another diagram illustrating towards the importance of the setting, that's the inner setting and the outer setting in the implementation process, and how all of these frameworks can be used to at different levels of implementation. Either you can merge them or you can use them individually. So when we talk of process models, these are models that actually guide the implementation process. Thus, it takes you from a translation phase, just translating what you know into practice. That's the main models that are used to bridge the no-do gap. Yeah, the example we're going to be looking at is a case that's knowledge to action model. Then we have the determinant frameworks, for example, the consolidated framework for implementation research. And these frameworks actually help you to identify barriers and facilitators that can influence the implementation of your EBI. And also, they are useful in guiding the selection of implementation strategies, because you know that the implementation strategies are leverages of your facilitators, and also you use them to be able to identify your barriers so that you know how to implement your intervention. You have classic theories and implementation theories. These are used to be able to understand why and how implementation strategies works, and generally why the implementation is going to be successful or not. You have evaluation frameworks that helps to identify the specific aspects of implementation that could be evaluated to be able to determine the success of your intervention. So we're beginning with the process models, and as example, be looking at the knowledge to action model. So the knowledge to action model actually involves the two main stages. That is two main actions in 7 stages. The first stage is the knowledge creation. The knowledge creation is usually shaped as this triangle because you have a broad knowledge, you have a broad idea of the problems that are in the community, and then they are synthesized to toolkits that can be used to be able to solve the problems of this community. So you have the knowledge creation, which is the first step, and then the second step, which is the action cycle, whereby you have after you've identified the problem of the community and you've developed the toolkit that you're going to be using to solve the problem, then you get into the action cycle phase, whereby the first step begins with the identification of the problem. You have to be able to know what they know about the problem. That's the people in the community or area where you're implementing your intervention. So this cycle is based on the problem that is being identified. That's the no-do gap. You want to be able to bridge it completely. So you have to choose a problem that is actually a problem in the society and not just what you think is a problem. And then the second is to be able to adapt the knowledge to the local concept. In this action cycle, the implementation of the best practice is considered as a result of the setting in which you find yourself. So you have the EBI you want to implement, but you have to be able to suit it to the context in which it's going to be best implemented. And then thirdly, you have to be able to assess barriers to knowledge use. Assessing barriers to knowledge use are the actions that are taken to be able to know that, okay, this is a barrier to the implementation of our intervention, and this is a facilitator. So identifying our barriers and facilitators help us to be able to know which strategies we are going to be using in our implementation process, which is very important. And then after that process, you should be able to select and tailor your interventions to suit your local context. That's to be able to leverage on your facilitators and then work on the barriers. Then you monitor the knowledge use. You monitor the knowledge use is used to determine if you need additional strategies to be able to continue with the implementation process or not. Then finally, you evaluate the outcomes. Evaluation here, you can use implementation outcomes as part of what you'll be evaluating. That's the reach, the adaptability, sustainability. Sustainability is itself is another stage, but it can also be an outcome for which you can evaluate. And then you sustain the knowledge use. So in this action phase, the strategies are implemented to support practice that can be replicated even in the absence of the fundings or absence of the intervention that is being implemented. And we should also know that this process is not a linear process. As we see, we have back and forth hours to show that at any point, if you feel like there's a need to go back, you can always go back before you go forward. So that's the good thing about these models, are that even though it provides a set of like a set of rules that you have to do, it's always a back and forth process. You don't have to strictly fit to your scripts in the implementation process. Then we're going to be looking at the determinant framework for us to be able to assess that's the barriers and facilitators for implementation. And our example is the consultative framework for implementation research. So this framework actually has 5 domains. And here we're looking at the first domain is the innovation. That is the thing to be implemented. What is the EBI what problems do you want to solve? What product are you bringing? That's your EBI. So it may be a new clinical training, maybe an educational program, it may be an intervention. So this program, this EBI has to be implemented in a setting, to begin with the inner setting, as we earlier mentioned. So the inner setting is where the innovation is going to be implemented. It can be a hospital, it can be a school, and there we're going to be looking at the structural setup, and look at the network, the cultural aspects, the climate, and even the readiness of the people to accept this intervention. Then we're looking at the individuals. The individuals in this case refers to like the government authorities, the the policy makers, or the characteristics of the individuals in the inner setting. All of these people can be considered as stakeholders, as one way or the other they can influence the implementation of the intervention or the project or the program or anything. Then looking at the outer setting is the setting in which the inner setting actually exists. So you have like a system of things going about, a hospital system, and then in the hospital system you have the antenatal clinic. So the outer setting is just like the main body, that's the policies or everything that can influence the inner setting. The process are the actions that are needed for sustainability, and the process we are looking at the relative advantage, the planning, the engagement, and the execution of intervention. So for application of the constituted framework for implementation research, it's used to provide a practical guide to systematically assessing barriers and facilitators prior to implementation. And the strength of this framework is that it's comprehensive, and usually using it alone can forfeit you using or implementing your project with different theories and framework, because I earlier mentioned that you must not use you're not limited to using only one framework or model for an intervention. You can always see how to bring them together to suit your intervention. But with the CFI, it's comprehensive, and so it can be used alone, and also it can be adopted for different settings. The one of the weaknesses is that it has many constructs. We saw 5 domains, but each of these domains have different constructs in them, and it can be also difficult to decide whether and at what level to apply this construct. So on how to use it, you should be able to assess each construct for its importance, and also you should be able to adapt and operationalize these constructs. This presentation really did not show us the different constructs because of time, but I hope that if we look further into our readings, we're going to see these different constructs and know how to implement them in our interventions. But the main aspect is just to know the different domains and the different constructs under these domains. So we're looking at the evaluation framework. Evaluation framework actually helps you to be able to know how well your intervention has been implemented, and it can be used at any phase of the implementation. That's the pre-implementation, implementation, and the post-implementation phase. And here, our framework of interest is going to be the re-aim. The re-aim talks about the reach. It has five main domains. That's the reach. That's the number of people that have access to the intervention. Is it reaching the target population? Maybe you want to focus on pregnant women. Are pregnant women the people that are actually using the intervention that you're bringing in? The effectiveness, does the intervention accomplish its goal? Then we're looking at the domain of the adoption. That's to what extent are those targeted, the pregnant women, to what extent are they taking in the intervention you're bringing in? Then we have the implementation. That's to what extent was the implementation consistent? That's in this implementation phase, you're also focusing on aspects of fidelity. If it's being implemented the way it was ordained or it was written down or proposed for implementation. And then looking at the maintenance is the extent to which the intervention becomes a part of the routine. That's the sustainability aspect. So how can I incorporate this intervention to be continue on a day-to-day basis? How can I sustain it? And for the application of the re-aim framework, you see that it can mostly be used to evaluate the effectiveness of an intervention. And it can also be used to compare two or more interventions across dimensions, taking into consideration their settings. Then for strength, goes beyond the evaluation process. It's also effective because it considers the reach, adoption, implementation, sustainability, which are also implementation outcomes. And weakness is that it's not recommended for evaluating implementations that reaches only a few patients or adopted by a particular setting. And then how can we use the reach? So these are some questions that you can ask if you're implementing the REAIM framework. You can ask what number or what percentage of the participants are taking in have accepted the intervention, or has this intervention gotten to what outcomes were improved, that's the level of effectiveness. What number or what percentage or have adopted the intervention, that's at the level of the adoption. And then at the implementation phase, you can ask to what extent were the various intervention components delivered as intended. And looking at the maintenance, you want to look at the long term, 6 to 12 months. How, to what extent has this component of the intervention been continued? That's a sustainability aspect. So an application of the REACH framework is the REAIM framework, pardon, is that a study evaluated a diabetes prevention program in community settings using the REAIM to assess how many individuals were reached, the effectiveness of the program in reducing blood sugar levels, the adoption rates by community organizations, and finally, the fidelity of the implementation of the intervention and the long-term maintenance of the intervention. So this is like an example of how the REAIM framework can be applied in different settings. Now, looking at the evaluation framework, which we're not going to dwell much on because we discussed earlier, which is Proctor's implementation framework, that it provides an understanding. It helps us to be able to explain certain aspects of implementation. And here we focus on the implementation outcomes, which we mentioned there are many of them, and not only on implementation outcome, but can also evaluate customer satisfaction. That's in terms of their satisfaction, client outcomes, and also population outcomes in terms of the mobility, mortality rates. So the last but one, you have the classic theories. So the classic theories, it's and it's a theory actually because it's backed by literature. It shows how an idea or a behavior diffuses into our society. And this theory seeks to explain why and how and to what extent a new idea or an innovation can be adopted in a setting. So we see that not everybody is equally exposed to some level of information. And this, for example, let's use an example of the use of mosquito treated nets. So in this setting, not everybody is exposed to the information about the mosquito treated net. And different people are going to begin using the mosquito treated nets in different ways, depending on the innovation, or how is the knowledge of the use of mosquito nets transmitted to them, the social system, how they are, the kind of people they relate with, and also the time factor, because we know that an innovation does not necessarily, when brought into the market, is not necessarily adopted at the same time, but with time and the different people that have been exposed to this innovation, they can easily pick up with with the intervention. Sorry. So when we're looking at the definition of innovation theory, we have five main stages of the adoption process, with the first stage being the knowledge stage. In this stage, we want to look at the individual's first exposure or the individual's knowledge about the intervention that is being brought into the market. So what do they know about it? Because it's based from what they know about it, that they'll be inspired to be able to take up the project or take up in the intervention or not. Is depends on what they know about the benefits of using mosquito nets, that they'll be able to, okay, I'm going to say, okay, I'm going to use the mosquito net or not. And also by looking at the perception. Perception are the perceived characteristics of the innovation. So is it relatively cheaper? Is it better than what we used to do? So these are the things that are going to give the individual an interest in adopting this innovation or intervention. And then also their ability to make a decision. In ability to make a decision, they can either adopt the intervention or reject the intervention. And then we're looking at the implementation phase, which is how the intervention is being implemented in a way that it suits the context, or in a way that everybody is going to be able to have equal access to it. And also the confirmation, where finally they know they're sure about the decision that they want to make, if they are going in for the intervention or not. And in terms of the adopters, people that finally accept to take in the intervention, you have the innovators, which are the people that bring in the intervention into the market and try to convince people to accept it. Then you have the early adopters. The early adopters are people that actually see that, okay, this intervention is good, that they have a high degree of leadership or awareness of what the intervention is, and they, within the least time, they easily adopt that innovation. Then you have the early majority. The early majority, these are the group of people that even after exposure to the knowledge of the benefits of this intervention, they are still not convinced. They still want to be sure to some extent. They say that, okay, yes, this intervention is good. And usually these people, they usually adopt the innovation at a higher time after the early adopters. Then you have the late adopters. They adopt innovation after every average participant, and they adopt the innovation with high degree of skepticalism. So they're very, even though they accept the innovation, they're still skeptical about it. And the last but not the least, you have the laggards. These are people that usually the last people to adopt the intervention, usually because of the social system. They have least exposure to the benefits or knowledge of this intervention, the communication channels, and even they usually take the higher time factor, meaning that they take more time compared to the innovators or the early adopters to say, okay, I'm going in for this implementation than the other group of people. So the major strength of this diffusion of innovation theory is that it's one of the most influential theories in knowledge utilization. And also it provides an explanation of how changes can occur. And again, just like every other model or theory, this can go back and forth because you can easily see what needs to be improved. Maybe I need to improve the knowledge of the benefits of using mosquito nets to make the people adopt the use of mosquito nets. Then I'll go back and increase the sensitization of the benefits of using mosquito nets. And in this way, you see that the percentage of people that are going to adopt it is going to increase. So yeah, you should be able to know that it's too simplified as one of its weakness, and also does not account for context. It focuses on the adoption rather than prevention of behaviors. That's one of the limitations of this theory. And finally, we're looking at the implementation framework. This is a framework that actually guides the implementation process. And for example, we're going to be using the exploration, preparation, implementation, sustainment framework. That's the APIS framework. And this framework actually, it talks about the key phases that can describe and guide our implementation phases, and also brings out the common factors within the different settings, that's the outer settings or the inner settings, that can either be a barrier or a facilitator to an implementation process. So the APIS framework has four main domains. You have the exploration phase, where stakeholders, all the stakeholders, everybody that is involved in bringing in the evidence-based in interventions, decide on which intervention is to be implemented based on the need of the community. And then the preparation phase, where they identify barriers and facilitators, and also this is through the need assessment. So they conduct the need assessment to be able to know what truly are the barriers, what truly are barriers and facilitators that are going to hinder or facilitate our implementation process. And then you have the implementation phase. The implementation phase itself is where the EBI is being put into practice. So yeah, you have to use the information of your barriers and facilitators to be able to bring into place. In the sustainment phase, which is usually an ongoing process. You want to know that, okay, how is this process, how is this intervention going to be sustainable? So I don't know if you can see my diagram clearly. It talks about the different phases of the APIS framework. Okay, so how do we apply this APIS framework? We're looking at the strengths is that it can be used for several purposes and it reduces the need for multiple theories. So once you use the APIS framework, you can be sure that the domains or the construct are going to cover up every aspect of your implementation. It's also very complex and difficult to understand. So how do we use it? You should be able to identify the ABI to be implemented, identify the purpose, how I know how you're going to use the APIS framework in your implementation process, and also the different phases when you're going to be involving the framework to be able to guide the process. And you should be able to bring out measures or construct that can easily be accessible, measurable. Yes, that's the outer context, the inner context, innovation factors, and bridging factors. And this is a typical example of our implementation process. So right away, we're going to go into models in implementation science, and I'll be passing over to Dr. Frida.
Okay, we are going to continue with models used in implementation science. Okay, the models that that are commonly used in implementation science are categorized by their primary focus or their approach. And as Jordanne mentioned, we have process models, evaluation models, change management models, dissemination models, and quality improvement models. So looking at these models, they have key characteristics in implementation science. First of all, they're characterized by their prescriptive, process-oriented, and context-specific nature, which provides structured, actionable, and outcome-focused guidance for implementing interventions. Also, they are systematic, they are linear or cyclic, and they are designed to be practical for stakeholders in diverse settings. By prescriptive, what do we mean? The models provide specific actionable steps or stages to follow during implementation. The frameworks describe what you are supposed to do, but the models, they tell you the steps that you are supposed to take while you plan to carry out and to implement your study. And they give us an idea of how to guide, outline what we intend to do and when, unlike the frameworks which are more descriptive. For example, when we look at the lower model, which was a model that was used in an evidence-based model, where they used to reduce the rates of catheter-associated urinary tract infections in hospitals. This model, it gave steps as to how to identify the problems, the evidence that they reviewed the evidence, and so they are also process oriented. By this, the model focus on the sequence or the cycle of activities required for successful implementation. That is, often you break down the implementation process into distinct phases. We have the planning phase, the execution phase, the evaluation phase, and sustainment phase. For example, the APIS model, where you need to explore, you need to prepare, you need to implement, and you need to be sure that what you're implementing is sustainable. So it gives it states the 4 phases clearly how it's supposed to be done. And lastly, they are context specific. For example, the models typically designed for particular interventions and settings. If you want to carry out, maybe if you want to carry out an implementation, if you want to implement practice guidelines, the setting is different from if a study where you want to look at community members and their behavior in utilization of certain vaccines. So depending on the setting, you have each particular model that you have to use. And also they account for the unique needs of the context in which the intervention is applied. Let's look at the example of the REAIM model. This model is tailored to evaluate public health interventions. By assessing, you have to assess the reach, you have to assess the effectiveness, you look at adoption, implementation, and maintenance. So they are very context specific. You cannot mix the models. So the types, when we look at the process models, these models outline a step-by-step or cycle process for implementing interventions. There's a focus on the how-to of translating evidence into practice. And it emphasizes sequential or iterative stages such as planning, execution, and sustainment. For example, when we look at the knowledge to action model, if you want to implement, let's say, for example, you want to implement certain guidelines that have been proven to improve the outcome of patients with diabetes, you first of all have, based on what the previous presenter presented, you have to know what is the knowledge about it before you bring in your intervention to implement the model. Then when we look at the lower model of evidence-based practice, it has specific steps in this model. First of all, they identified that urinary tract infections, catheter-associated urinary tract infections were high, the rates were high in the hospital. And based on evidence that they had in other settings that had been used to reduce the occurrence of catheter-associated urinary tract infections, they brought in their evidence and they piloted in one unit. After this, they scaled out the evidence in all the other units, and in the long run, their outcome was that the number of catheter-associated urinary tract infections that they had reduced. So you have to, first of all, you have to go through all that process before you carry out your implementation. For the evaluation models, these models focus on evaluating the impact and the success of an intervention across multiple dimensions, such as reach, effectiveness, or sustainability. If you've conducted a study, how do you evaluate the intervention that you've implemented? You need an evaluation model. And it provides the criteria or metrics to assess implementation outcomes that we often use for planning and evaluation. Example of this is a pre-seed post-seed model, which combines planning with evaluation. The next is the change management models. These models mainly focus on managing organizational or behavioral change to support the adoption of interventions. And their main characteristics is that it emphasizes the strategies to engage stakeholders. It addresses with this resistance and align systems for implementation. In this case, we have the awareness, the desire, the knowledge, ability, and reinforcement model. And their focus is to guide individual and organizational change by addressing 5 key elements needed for successful adoption. Another example here is the health belief model. So when we look at example of the lower model, this model, as we said before, it provides step-by-step process for integrating evidence into practice, starting with problem identification, evidence review, and piloting, followed by implementation and evaluation. So an example here is we have a hospital use the lower model to introduce a new protocol for reducing catheter-associated urinary tract infections. The process that was involved reviewing the evidence, piloting the protocol in one unit, and scaling it up across the facility, leading to significant reduction in catheter-associated urinary tract infections. So it goes through all the steps, and at the end, it evaluates the outcome, which was the reduction in catheter-associated urinary tract infection rates. Another example is a pre-seed post-seed model. In the pre-seed phase, here it has 4 phases where you have social assessment, epidemiological assessment, educational and ecological assessment, and administrative and policy assessment, and intervention alignment. Here you have to assess the needs, the epidemiology, social, and behavioral factors. Then in the post-seed phase, here you look at the outcome, you evaluate, you implement, you carry out process evaluation, you carry out impact evaluation, then outcome evaluation. So you implement and evaluate at the post-seed level. For example, we have a case where a model for understanding the relationship between stigma and healthcare seeking behavior among people living with HIV/AIDS in sub-Saharan Africa. So they adopted the positive portion of the model as an explanatory frame for health-seeking behavior among HIV-positive people in sub-Saharan Africa. So in this case, the model identifies the predisposing, reinforcing, and enabling factors that were affecting the outcome of non-utilization of healthcare. So the next is the health belief model. So we see in this model that it has six key constructs: the perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self-efficacy. Here we see that people are more likely to adopt a health behavior if they believe that they are at risk, and if they believe that the consequences are serious, if they believe that the behavior will reduce the risk, and if they feel confident in their ability to act despite potential barriers. So they need perceived susceptibility. Do they believe that there's a risk of getting the condition? And if they believe, does it have serious consequences? Is a belief perceived benefits, belief in the effectiveness of taking action? The actions that they are going to take, is it going to reduce the consequences of the disease? Perceived barriers, their belief about the cost or obstacles to taking action, and what are the triggers that will prompt behavior change in these individuals. So here we use it, this health belief model is used mainly in vaccination adherence. Remember when we had COVID, when we had the COVID-19 pandemic, a good number of persons were skeptical to take the COVID-19 vaccine, but after education, and when people saw that when people saw that they were actually at risk of having the condition, and they saw the consequences when they lost their family members, that's when it triggered them to change their behavior, and some were isolating and taking their medications. Another aspect is smoking cessation, preventive screenings, and sleep hygiene. So these are some of the applications where we can use the health belief model. Another model is a socio-ecological model. It influences at five main stages. We have the individual level, where we assess their knowledge, their attitudes, their skills, and any genetic predispositions. Interpersonal level, the family, friends, social networks. Organization/institutional level, where we look at schools, workplaces, healthcare settings. Also community, neighborhoods, cultural norms, local resources, and policy or societal, where we have laws, regulations, economic and social policies. And when we look at an example, for example, if we want to use the socio-ecological model to address physical activity among urban adolescents, at the individual level, we want to educate teens on the benefit of exercise, and we build their skills for active lifestyles. And at the interpersonal level, we engage parents and peers to provide social support and encouragement. At the organizational level, we work with schools to implement quality physical education and after-school programs. Then at community level, we improve access to safe parks and recreational centers in their neighborhoods. Then find the last stage, which is the policy. We advocate for city policies that fund pedestrian-friendly infrastructure and physical activity initiatives. So this is part of a socio-ecologic model. So how do we select an appropriate theory model framework intervention? First of all, you begin by identifying your problem and your evidence-based intervention. This is very important, because you need to identify, when you identify your problem and your evidence-based intervention, you ask yourself, is there one right theory model framework for the intervention? If you want to implement certain guidelines, if you have realized that a good number of patients die from road traffic associated injuries because probably at the emergency department, the patients do not receive adequate hospital, pre-emergency care? Is there an intervention? Is there a guideline that you want to implement to address that? So you have to, first of all, identify your problem, and you see which theory model framework will go for this intervention. Then also we need to consider several theory model frameworks that intersect nicely with the intervention or study. There's you may want to carry an intervention, and maybe the theory or the model that you want to use cannot be used alone. Maybe you choose a process model, but in choosing a process model, when you implement, will you be able to evaluate with the process model that you choose to conduct this intervention? So you have to look all of that and choose the ones that will go for your intervention. Then the next step is to conduct a brief literature review to find support for your theory, model, and frameworks. This is very important. When you look at other studies that have been done similar to what you are carrying out, it gives you a template on what to work with. Then you apply your answers to how the theory model framework connects to your problem, the study's purpose, significance, and the design. Then lastly, you select one or more theory model framework that provides a solid descriptive blueprint for the evidence-based intervention. So this is the last step. So these are the steps that you need to use when you want to select an appropriate theory model framework that you want to do in a study that you intend to implement. So these are some of the resources that you can use for further studies. So we'll conclude by saying that implementation science theory model frameworks are essential tools that bridge the gap between research and real-world practice by providing structured, prescriptive guidance for translating evidence-based interventions into effective, sustainable outcomes. And we need to embrace implementation science models as practical roadmaps to turn evidence into action. Then choosing the right framework or model based on your context and goals. Engage stakeholders actively and adapt as needed to overcome the challenges that you may face in the field is very important. So these are some of the references that we use for this. So we have two assignments. The first scenario is you are part of a team tasked with implementing a cervical cancer prevention program in a rural health district in Cameroon. The intervention involves introducing self-sampling for HPV testing and community health centers with follow-up care offered through referral hospitals. Many women in the district have never been screened, and there are known challenges, including stigma, low awareness, limited transportation, and poor linkage to follow-up care. Using the scenario above, select and justify one TMF from each of the following categories to guide your implementation plan: a process model, a determinant framework, an evaluation framework, or any other theoretical model framework. For each selected theoretical model framework, describe why it is appropriate for the intervention and setting. Then you apply the framework to describe key steps, barriers, facilitators, or evaluation indicators. And lastly, you provide at least one specific example per theoretical model framework. That's how will you assess reach in re-aim or inner setting in consolidated framework implementation research. So you summarize your approach in a brief write-up. Then the last assignment is, what implementation science model will you use for the following studies and why? Designing an implementation plan for a new vaccination program, evaluating a mental health intervention in schools, and implementing evidence-based guidelines in a clinic. Please provide brief responses. Thank you very much.